Good afternoon, everyone. My name is Grace Mwabili. I'm one of the members of Clique event, and today we planned an Afya day, which is happening virtually. So I'll take you through some of our members who are included in the Clique event. So we have Faith Wanjiro, who's our operations manager. We have Frida Wamboi, who's our event coordinator. Then we have Faith Maina, who's our secretary. Faith Maina, the third slide, kindly. Third slide. Yes, we have Faith Maina, the secretary. We have myself, who's the treasurer, Grace Mobili. Then we have Njoki Kuria, who's our sales manager. We have Sydney Kamau, who's the social media coordinator. Then we have Robert Ouma, who's our IT stroke, the person who's engaging the audience. So I'll give you a brief on what Clique event is all about. So Clique event is organizing a corporate social responsibility event, that is CSR, where it's going to target the members of the community and the student of Multimedia University of Kenya. The event is to be held on the 9th of October 2020, which is today. The medical event is an initiative from medical practitioners to provide free healthcare awareness to the community. As Clique events, we love to live by the tagline, we create, you celebrate. To facilitate this event, our guests will be UAP Insurance, Avenue Hospital, whereby we are looking forward to being of service to our fellow students and the community at large. So UAP Insurance is an integrated financial service business comprising of Faulo Microfinance Bank, UAP and Old Mutual. UAP and Old Mutual have been major players in the financial services market in East Africa for decades. The two entities have vast experience in insurance. With that, let's get to hear more on the importance of being insured. So Avenue Hospital was founded in 1995 for the purpose of managing the outpatient department at the hospital and to extend medical services to corporate clientele through an innovative concept of managed healthcare. Well, Clique Events has given you the chance to get to know more on matters involving lifestyle diseases, mental health, among others, which you're going to hear today. So we are privileged to have you all on board. Let's get to know more about our health. All this courtesy of Clique events planners. We create, we celebrate. Thank you so much. Back to you, Faith.
Thank you so much, Grace, for that presentation. I hope now everyone is aware of what we are doing here today, what we are about to engage in. And I'd like to acknowledge Dr. Carl from Avenue Hospital. You're welcome, Daktari.
Asante.
So, karibu. So I'd like to welcome Dr. Carl, who is going to take us through three major topics, which are lifestyle diseases, mental health, and also stress management. Over to you, Daktari. You can proceed.
Am I able to share the screen?
Yeah, sure. Are you able to share?
No.
And now? Are you able to share now?
Yes, just one minute.
Okay.
My screen is visible?
Yes. Yes.
Okay. Okay, so my name is Dr. Carl Daniel, and I am a medical doctor, and I also have a master's in public health, and I'm also the manager for Rongai Clinic. So today I wanted to talk about lifestyle diseases. Since this forum is supposed to be a Q&A, I will just touch on a few things, and then if there are any questions, I'm going to answer in depth. Yeah. Okay. So what are lifestyle diseases? So these are diseases which basically come about because of the way we live, where we live, and how we interact basically with the environment. Okay. So as you can see that guy over there, a bit of unhealthy behaviors. And also sometimes there are factors like, for example, if you live next to a factory or next to a road where there are lots of trucks which pass by with the fumes and all that, that is also a factor which can affect your health. Okay. Now, first of all, I'd like to say that this month is Cancer Awareness Month. I don't know if you guys are aware. Yes. And cancer is one of the lifestyle diseases that I'm going to talk about, although I'm going to focus on 4 major lifestyle diseases. And I will start by talking about obesity. Okay. And by mentioning obesity, most people talk about or think about cholesterol. Okay. And most people think that cholesterol only affects people who are a bit overweight, and people who are slim like me usually don't go for testing because we think that we're in shape and all that, and our cholesterol levels are well controlled. But that is not the case. Cholesterol levels can be high in somebody who is even slim like me, or somebody who's who exercises and all that, because it's got more to do with your eating habits and the environment that you're in. Yeah. The picture that you can see on the screen is shows the blood vessels, different blood vessels. The one on the top doesn't have any deposits of cholesterol. We usually call them atherosclerotic plaques. So it doesn't have them. The second one has a bit of that, and the third one you can see is completely blocked. Okay? And this is usually what happens to you when you have high levels of cholesterol. I will touch on how to basically avoid having high levels of cholesterol later on in this presentation. Okay. So, the lifestyle diseases. We have cardiovascular diseases like heart conditions, heart attack, for example, congestive heart failure, things like hypertension. We have stroke also. We have diabetes, cancer, like I've mentioned. Then we have things like chronic obstructive pulmonary disease. This one usually looks like asthma, but affects mostly the older people in their 40s and above. Okay. Then we have depression, and we have musculoskeletal disorders. So all these are things that you can avoid by making certain changes in your lifestyle. Okay. So as I said, I'll focus on 4 major ones. The first one being the cardiovascular diseases, which affects many people, as you can see on the slide, over 17 million people. And as we become more and more, as more and more people live in the cities, we end up eating a lot of fast foods, and we get involved in work or activities which are really not active per se. It's more of sitting down and workings. So to avoid cardiovascular diseases, there are certain things that you can modify and there are things that you cannot modify. And as you can see on the table, you can change tobacco use. For example, you can avoid being obese. You can avoid taking alcohol and monitoring your pressure, making sure that your pressure is in check. Things that you can't change, of course, we know there are people who are at high risk of cardiovascular disease because of their age. There are genetic factors. There is also some gender have a high probability of getting an infection, not an infection, but basically the cardiovascular disease than others. Yeah, so I was talking about diabetes, which is the second lifestyle disease that we can modify or change. Yeah, there are different types of diabetes. As you can see, there's type 1, type 2. There's gestational diabetes, which happens during pregnancy, and there's pre-diabetes, which is basically glucose intolerance. Yeah. This one also you can avoid by making certain changes. For example, being physically active, avoiding unhealthy diets, and avoiding also alcohol use, in addition to your stress conditions, avoiding stressful conditions. Yeah. Things you can modify again is just the race, family history, and all that. Okay. Then we have cancer. There are different kinds of cancer. And cancer also has a family predisposition, basically genetics. But apart from that, like avoiding smoking, there's the HPV virus, which there is a vaccine for it, which can be given, which is being given by the way currently. So anyone who's interested can ask more about the HPV vaccine. Okay. Then we have lung cancer, which you can avoid by avoiding smoking, not only smoking, but also exposure to the different components mentioned there, like soot, tar. Like you're not supposed to use what is it called? The charcoal. Most people who use charcoal end up having issues in their 60s if you live beyond 60 years. So that is something, if you can go for gas, the better. Okay. Then things like asbestos, nickel, arsenic. Okay. So if you're working or living somewhere near industrial area, those are things also you should look out for and avoid. And if you notice maybe there's an industry which is polluting the air, for example, that is something that you can campaign for the government to look into. Then we have breast cancer, which you can avoid by, there are many hormonal therapies nowadays, which are not sanctioned by doctors. So you can avoid that. And apart from that, also keep your weight in check and being physically active. The other risk factors on the left are just showing there are people who have certain genes which can actually be tested in a lab. So if you have the BRCA1 or BRCA2 genes, then you have a high probability of getting breast cancer. And note that breast cancer does not only affect women, even men can be affected. So being the month of breast cancer awareness, I expect men also to learn how to check for lumps or any unusual changes in skin on their breast. Okay. We have prostate cancer, which you can also avoid by changing your eating habits, avoiding being overweight, and increasing intake of fiber in your food. We also have colorectal cancer, which you can also avoid by eating lots of fiber and fruits, which have I've forgotten the term, but I will, if I remember, I'll mention why you should take lots of fiber to avoid colorectal cancer. Okay. And we had also mentioned the chronic obstructive pulmonary disease, which gives you asthma-like symptoms. So you should avoid smoking. Any form of smoking you're supposed to avoid. And also dust and the other chemicals that we have mentioned above. Okay. So as I said, for most of these lifestyle diseases, the main things to avoid is a sedentary lifestyle, basically going to work, from work, going home, watching TV. So there's nothing else you're doing, basically, just sitting. All like 90% of the time of your day is spent sitting and not being very active. Okay. Secondly, the cholesterol. You have to keep your cholesterol in check, and you can only know this if you test. It is advisable to check your cholesterol levels at least once a year for everyone, not only people who are obese. Okay. Smoking, you stop. And diabetes basically is you avoid adding weight, especially the fat on your belly and the fat on your neck. They are known for increasing insulin resistance. Okay. So how do you lower your cholesterol? When you buy cooking oil or food stuff, there is always a small label which shows the ingredients, and you can see sometimes it's written saturated or unsaturated fatty acids. So you should consume food stuff with less of saturated fat in the diet. So you should be keen when you're buying things from the shelves. Okay. Apart from that, the meat that you buy should have less of the fatty layer. When you're preparing the meat, we should get that one off, and that will also help a lot. When you're buying dairy products, also you'll get dairy products which have low fat levels. They are always written in detail, so you should be keen on that. You should eat less processed food, especially canned food, but canned fish is okay. You can go ahead with that. And the other one, the mono one or polyunsaturated, that's still the food stuff, which you read whether it is saturated or unsaturated. Okay. When you are cooking, your cooking oil has to be, you prefer vegetable oil. And I think our cooking oil can be either olive oil is good. They have the sunflower depends. Okay. Yeah, so you can opt for that. And also when you're using oil, it's better to use the non-stick cooking pot, because when you're using that one, you're going to use less of oil, because the sticky ones, you'll find that you are putting lots of oil so that whatever you're cooking does not get stuck on the or in the pot. Okay. So reasons why you should avoid adding extra fat. This is just a drawing showing different body organs and how fat affects these organs. And we've mentioned stroke, as you can see over there. Stroke, which is basically formation of clots, or sometimes even a bleed of the blood vessels which supply the brain. And this one will happen because of disposition of cholesterol in those blood vessels, making them thin, and that way it increases the pressure in the blood vessels. And that's how you also end up with hypertension, yeah? And hypertension can actually cause headache. So sometimes when you find that you're having a headache which you can't explain, and this headache normally develops later in the day, you don't actually wake up with it, then you might be having pressure issues. It's always good to pass by the nearest facility and have your pressure levels, blood pressure levels taken. Okay. We also have pulmonary disease. I think you've heard about people who just fall all of a sudden because of a clot in the lungs. COVID is also notorious for causing pulmonary embolism. Okay, and apart from that, also you can see even sleep apnea. Basically, people will snore as they grow obese, and that way, when you are obese and you are having sleep issues, especially when you're sleeping, it means that you will be doing more of carbon monoxide than oxygen, and that will affect many other things. Okay, as you can see, they talk of hypoventilation. It is like you are not having enough oxygen. And you can see also fatty liver disease. Also, the cholesterol are usually deposited on the sides of the liver, and this can cause issues like cirrhosis, basically damage of the liver itself. You can have issues with the gallbladder. Basically, the bile is what is used to digest fat. So if you do lots of that, you also find yourself with increased risk of developing stones and all that. You can see gynecology issues. I don't know if you've heard of polycystic ovarian syndrome, PCOS, which is quite common in obese people. They normally develop PCOS and diabetes. And this is because of obesity. That is one of the factors. It's not the main one. You can also have irregular or abnormal menses and even infertility. Okay. You can develop arthritis. There are also skin changes. Gout is also a factor if you're not eating the right food. Okay. Inflammation of blood vessels is also a factor. And we talked of cancer already. Pancreatitis, basically when you take too much alcohol. I don't know if you guys know Avicii. That was one of the reasons why he decided to end his life, because pancreatitis is a very painful disease. Okay, and we've mentioned hypertension. Dyslipidemia basically means high cholesterol levels, and we've also mentioned coronary heart disease, basically, which is disposition of the fatty cholesterol on blood vessels, which can cause the heart to stop beating, or a part of the heart to die. Okay. And I also wanted to mention that most people don't find it important to concentrate on the weight of young children, but even children who are overweight should be advised to be careful. To monitor their weight so that they don't end up with the complications. Yeah. So to reduce obesity and promote good health, you have to have a healthy diet, and a healthy diet means you have to have your what's it called, the plate should be balanced. And one way of knowing that you are doing the correct balance is that 2/3 of your plate should have vegetables, the other third should have the carbohydrates, and then the proteins can take the rest of that plate. And you can actually measure in terms of cups. Here they're offering like 2 cups of fruits, half a cup of vegetables, okay, so that you know you're having the right calorie diet. Also, it is good to exercise on a daily basis. Weekend warriors are not healthy. So if you find yourself only exercising over the weekends, that is not advisable. Ideally, you're supposed to exercise 3 times in a week. Okay. And also to do the regular checks, like checking your blood sugar, cholesterol levels, and doing the screening, for example, for cancer. Okay. I think that's it from me. If you have any questions, I'm open to questions. Any questions?
Yes, Dr. I have a question.
Mhm.
When you say cancer and what is it, diabetes is a lifestyle disease, what happens to those ones that maybe you find that your grandparents had it, then a small kid is born, maybe 7 years old, then gets it? Can you say it's a lifestyle because they're still young? How can you put it?
Thank you, Grace. What we mean by lifestyle, as I mentioned in the slides, there are many factors at play before you get cancer, or before you get diabetes, or before you get hypertension. There are factors that are constant and you can't change. For example, if you have a family history of cancer or diabetes or hypertension, then you are at a high risk. But it is not clear cut that because your grandfather or your mother has diabetes, you're also going to have diabetes. If you in a high risk, then you should be very vigilant in that the factors that you can change, you follow it to the letter, and that way you're going to avoid ending up with diabetes or ending up with hypertension or cancer. Does that answer your question?
Yes, it has. Thank you so much. Thank you.
Jackie Kuria, you'd like to ask something?
So my question is to Dr. How can you boost your immune system generally?
Okay, thank you. First of all, exercise is one of the ways that you can boost your immune system. There are many studies which have been done which shows that if you do not exercise, then you'll find yourself with a higher chance of falling sick, for example. Okay. Secondly, for example, during COVID, we were advising people to take things like ginger, garlic, and the like, because they have some bactericidal effect. They can actually, taking it, it can kill bacteria, it can kill viruses. It's also a way of boosting immunity. So it is advisable to take that in your tea and all that, and even to add it in food when you're cooking. Thirdly, a balanced diet. And that said, balanced diet means that the plate should be balanced. 2/3 veggies, a third carbohydrates, then a small amount of proteins. And we should eat proteins on a daily basis because proteins are not stored in the body, and they are very important in building of tissues. You know. Yeah. So those are the three main ways of boosting immunity.
We have a question from William Onea, who's saying thank you for having us. And also, Dr. you said meat can be a factor that contributes to obesity. Does this mean vegetarians live a more healthier lifestyle?
Not really. Thank you, William. As we said, everything is important in life. Okay. For example, if you are eating good food and you're not hydrating, then you will still end up with problems. If you're only eating, for example, I'll give you an example. The Indians who eat only vegetables usually suffer from vitamin B12 deficiency. Okay. And that comes with many, many complications. For example, vitamin B12 is very important for the nervous system. So they will come with, for example, feeling numbness on the hands, or pain, or some burning thing passing on the leg or something like that, and many, many other factors. So it's all about balancing and taking the right amount. So the main point is to take the right amount of everything. You cannot do without one thing. If you're not taking meat, then you should make sure that the vegetables you are taking, like the beans, also rich in proteins, are included in your diet.
All right, thank you for that. Also, Ron has a question to you, Daktari. How can one know their BMI?
Okay, so your BMI is measured according to, there are two things that you take, your height and then your weight. So you divide that, there's actually a formula, and that's how you know your BMI. I think nowadays there are many apps which you can install on your phone, and it will calculate for you automatically. So, for example, somebody who is tall is allowed to have more weight than somebody who's short.
Okay. Well, I also have a question.
Okay, so.
On chronic pain. How do you deal with, what is your advice on dealing with chronic pain without using medication?
Okay. Now, first of all, I'd like to say that pain is dependent on an individual, and the mechanisms of pain in the body. And that's why we have, for example, if you're having a headache, there is a painkiller which will work better for that headache than when you're having a stomachache. Okay. For example, I would give you paracetamol for a headache, and if you're having a stomachache, something like Buscopan would actually work way better. Okay. So nowadays we have pain specialists, like there is one at Aga Khan Hospital, and there are many things that we can do. Even acupuncture is an option which is offered. Okay, people who have arthritis, there is a physiotherapy for them which is given, and the more they do those physical exercises, the less they get dependent on oral painkillers. So it would basically depend on the type of chronic pain, because there are some pain like for cancers, the patient will have to be on painkillers, and there will be very little options for non-medical pain relieving regimens.
All right, Faith, I saw like your hand was up. You'd like to ask something?
Yes, I have a question. Doctor, is practicing intermittent fasting healthy?
Yes, it is. It is very healthy. First of all, I would say it is something that has been practiced since ancient times, basically even for clearing your alimentary canal. So it is something that I would advise, but it depends. If you are diabetic, then maybe you need to consult your physician before you do that intermittent fasting.
So you're supposed to practice like 16, 18, 20, how many hours maximum?
I would say what your body can handle.
Oh, wow.
But when you're fasting, you have to do a lot of hydrating, okay? And it should be something, when you are starting, like you've never fasted. Okay.
Okay.
All right, from the comments, we also have questions. Is diabetes a genetic disorder? Also, below that, there's also a question on, is blood pressure also a genetic disorder? Disease?
I would say it is not a genetic disorder, because if it's a genetic disorder, it means it's something that you're born with.
Yeah. From Ron, on the point of arthritis, apart from exercise, is there a diet one can take to reduce the risk of getting arthritis?
Well, arthritis, for example, if you have a family history of arthritis, we can say that we can delay the onset of arthritis so that you don't get it at an early age. And for example, we know about gout. which is ends up like when you have a disposition of uric crystals on the joint spaces, basically where you have the synovial fluid, which is the fluid which is found between your joints. It ends up damaging the bones, okay? So you can avoid foods which will increase uric acid levels, okay? Secondly, taking food which is rich in calcium and phosphorus, because the bones are basically made up of calcium and phosphorus. So if you don't take enough of calcium, when the body needs the calcium, it's going to take it away from the bones. And that's why people who are aged will, when they fall, not even from like a height, they end up having a fracture. Because as you age, your intestines do not absorb calcium as much as they do for a young person. So ensure that your daily food has calcium which can be absorbed by the body.
All right, thank you. Beryl, you'd like to say something?
Yeah, thank you, Faith. I'd like to ask a question. I had Terry talk about the HPV virus, and I've had a lot of myths about the vaccine that I'd like you to clarify. The first thing I've had is that the vaccine, number one, is only available to those who have not had sexual contact, and the second thing is that it's available up to a certain age. So I've had 26. I think it's only available to those who are up to 26 years old and not above that. So I'd really like to know. Thank you.
Okay, thank you, Beryl. What I would say is HPV vaccine was being offered by the government. And when the government offers something, they want to maximize on, for example, let me tell you why they before actually they were saying they should only give people who are under the age of 13, yeah? Or people who have just reached adolescence. And that was because they were like, that group has not been exposed yet to the HPV. So giving them the HPV would be best for them. People who are sexually active, you'll find that majority have already been exposed to HPV virus. So, and the test itself is quite costly. So most people don't even test for it, and most insurances don't cover for that. But that said, HPVs can still be given to anyone, and you can pay for it and have it given to you. Okay, so it is not age limited.
All right, thanks for that. Any more questions for Dr. If you have any questions, kindly ask. Dr. could you please touch on stress management? Just a bit of stress management.
Okay, on stress management. Okay.
Yes.
Now, I'm not a psychologist, or, but I would say one thing, yeah, that in life, everything matters. And in life, it's all about balance, okay? Money is not everything, but money is important, okay? Education is not everything, but education is important, okay? So when you're planning your life, you have to make sure that what you are going after, first of all, you're comfortable with it. If you're not comfortable with it, then don't go ahead doing it. I would give an example. If you are choosing the profession that you're going to do, I being a doctor, this is something I'm going to do for the rest of my life, okay? If I get bored, then I have to now change completely into something else, okay? So if I don't like seeing patients, or I don't like doing what I'm doing, then after some time I'll get bored, I'll get depressed, because it is a stressful job. And I think every job is stressful. So if you don't, if the kind of job you're choosing is not something that you don't need an alarm, that you need an alarm to ring like 6 times for you to wake up, and yet on weekends you don't have a problem waking up, then that is a warning that you don't like your work. You need to change, okay? Because mental health is very, very important. You can be the prime minister or the president, but still you get depressed, and you will feel like the world is over, okay? Secondly, you have to accept that life is difficult, okay? Difficult in the sense that there are things beyond your control. Like the way we mentioned about these lifestyle diseases, you cannot change your genetics. So if your genes are trying to, for example, if you have that BRCA1 and BRCA2, which predisposes you to breast cancer, then you really can't change. It is a gene that is in your system, okay? So it's something that you know, you accept, and you live with it, and you focus on the things that you can change, okay? So in life, there will be ups and downs. You're going to lose your loved ones, okay? You're going to make new friends. You're going to lose others, okay? It is okay to cry. Even men cry, okay? So, and you should make sure that you have a circle of good friends, okay? Because with friends you're going to make it, not only during those hard times, but also networking. Because at the end of the day, companies employ their friends. If they don't get a friend who has that qualification, that's when they look outside. So it is good to have a good network. And that way, when you're going through hard times, you'll be able to survive. And then thirdly, I would say the extracurricular activities that you're doing, that exercise, which is good for your mental health. Going out, not just staying in the house. It's always good to change the environment, even if it is taking a walk. It is very, very important. Okay. And then what else? Yeah, and the third thing I would say is if you are living, sometimes the environment you are living in is what is actually stressing your life. Maybe members of your household, or I don't know, people in class. I would tell everyone that the world is big, and you can always go to Tanzania, there is Zimbabwe, okay? And now with internet, you can actually widen your scope. And I would give an example of, for example, people who draw, okay? You find that you're drawing, but when you're trying to sell your artwork in the environment you're in, nobody has interest. But then you put your art online, and you find, for example, people in Brazil are so interested and they're buying your stuff, and you're making money. So don't live in in an enclosed world. Open up your world, and you will be happy. Yeah.
Okay, thank you so much for that. There's a question from Ron. Ron asks, is Coke Zero still able to be taken by someone suffering from diabetes? He also asks, touching on stress, what would you recommend for someone who has an eating disorder because of stress?
So Coke Zero. I think it is safe for taking. Yeah, so you can go ahead, but in general, let me tell you the truth. Abroad, people don't do Coke anymore, be it Coke Zero. Yeah, because there are many other things inside it which people have said it is not safe to take. And you'll notice that the main company is trying to venture into other things, because they think in the next 15, 20 years, people will no longer be interested in taking Coca-Cola. But I am not against Coke, so you can go ahead and take Coke Zero, okay? Stress because of eating disorder. I think, first of all, you should see a nutritionist, first of all, and also see a psychiatrist, okay? Because if you're losing weight because of stress, there are many options for you. There is something we can give you to boost your immunity, first of all. And secondly, we have to find out the root cause, because whatever is stressing you is not what is stressing the other person. So I think it would be advisable for that person to see a specialist, and from there they can be advised on the way forward.
Okay. Njoki, you'd like to say something?
Yeah, thank you, Faith. So, to Dr. You've told us on many ways on how we can prevent stress from cropping in, and also I've had there are people having eating disorders to cope up with stress. So now that you've mentioned those symptoms, can you please give us a few symptoms that we can look out for people who are experiencing stress and we may not see it? Because I mean, for everyone, especially since March, I think we've had a hard time, all of us, and most of us cannot even be able to point out if anyone is having stress. So kindly, you can give us some of the symptoms to look out for in our friends and family, and even in ourselves.
Okay.
Thank you.
Thank you, Njoki. First, as you said, it's very difficult to know if somebody is facing a stressful situation or not. And I think the best way to know if somebody is stressed is to spend time with them. And sometimes, you know, first of all, I would say, call them. And when you call them, don't just call because, for example, you want something from them. You can call and ask, you know, how are you? How have you been? What did you do today? You know, like you're actually probing to know what's up. Because sometimes people are afraid to share their experience or what they're actually having. And they might not open up during the first call, okay, or the second one. But I would say there are always, if you've been spending time with someone, there are always signs. First of all, they will withdraw. Okay. For example, if they used to jog with you, nowadays you call them, they're like, I'm busy, you know, there's something else I'm doing. But it is actually a lie, and you know that it is a lie. Or secondly, they are not keen on, before they were so much into fashion, now they no longer bother much about fashion, okay? Before they were so eager to get a certain job, now they are no longer interested. They're just like, you know, let anything be, okay? So it's basically a change in behavior, and you'll only notice this if you spend time with them, yeah. But as you've said, it's very, very difficult.
All right, thank you. Also, the question I've been asked, somebody has been tested for anemia, I think 9.8 something, and asking what foods they could take and what supplements they could take.
Okay. Now, iron, food rich in iron is, for example, liver. Liver is very rich, and you don't need to take a lot. You don't need to take it every day, because I know some people don't like the taste of liver. 3 pieces of liver is good enough in a week. If you don't like the taste of liver, you can grind it and add it to other foods like your nyama, stew, and all that. Okay. Beetroot is also nice. I know also the taste of beetroot is not good, but you can make a smoothie with the beetroot, and you will enjoy. But deficiency of like low level of blood can also be because of not only iron, but also folic acid and many other factors. So we always advise that apart from that, you also do vegetables, green leafy vegetables, not overcooked. Vegetables are supposed to be cooked for maximum of 10 minutes, but I know most people are afraid, so they overcook them until they change from that bright green to some dull color. Yes, so she can do that, or he. And also we have iron supplements. They can take any iron supplement for a month or 2. Yeah.
All right, thank you so much.
Grace Mabili, you'd like to ask a question?
Thank you, Faith. Is the related to stress? And if yes, how can you advise on that? And I've heard some people say that it's hereditary, that if your mother has,
Kindly
you can
repeat.
get.
I didn't hear the first bit.
Oh, sorry. Is depression part of stress? And is it hereditary? If your mom or dad has it, can you get it?
Okay. So, stress leads to depression. That's all I can say. Because I would say, like, for example, you're putting too much weight on in your car every day. Okay, it's supposed to take in 4,000 kilograms, but you are always carrying 6,000 kilograms. Okay, it's not going to break the first day or the second day. It will be able to manage, but over time, we'll start seeing that car kind of wearing out pole, and maybe the tires will get finished very fast, or the shocks will start showing, and you'll see like it's almost touching the road. Okay, so stress can lead to depression, and that's why we always advise people to avoid stressful situation. If your work is stressful, try and change that, or if you can't change that, then change jobs. If school is stressful, try and change that. If you can't, change schools, okay? Because once you reach the level of depression, it's very difficult to get out of it, okay? Depression is not hereditary, but I would say that there are studies which are showing that there are some genetic predisposition to being stressed, okay? So I would say that there is some truth into it, but in terms of stress, but not depression. So if you have a parent who was depressed, then you will not be depressed. That said, I'll talk about mental health. There are certain diseases which have a hereditary predisposition, and those ones, yes, if your mother had it, you'll end up having it.
All right, we have a question from the comment section. Does H. pylori cause cancer?
No, but having answered that, I would say I'm a scientist. So if there is anyone who thinks that they've gotten cancer because of H. pylori, then they should bring that one forward. And as scientists, we are going to investigate. The same way with the coronavirus. Whatever information we had at the beginning of the epidemic has changed dramatically, because at the end of the day, investigate. We don't just say, no, it's not it, and we push it aside. But as we speak now, there is no case of H. pylori causing cancer.
All right,
But that said, gastritis, H. pylori causes gastritis, causes ulcers, okay? And this overwhelming of the mucosa of the gut, okay, can predispose you. It can cause unusual development of the cells, like overgrowth or stuff like that. So it can end up forming precancer cells, and then you can end up with cancer. Okay, but I wouldn't say that it is because of H. pylori. Majority of us have H. pylori. And we do not have symptoms. And that's why most doctors and even gastroenterologists advise that just because as a doctor I've seen H. pylori doesn't mean that I have to give you the H. pylori kit.
All right. Thank you so much, Daktari. I'd like to ask to kindly request you to just write on the chat box, kindly give us your details and where we can find you. So that if anyone needs like to follow up something to you, they can come personally to where they can find you. I hope that's okay with you. Do we have more questions for Daktari? Clique events planners, do you have more questions?
Yes, I have a question. Let me take you back, Daktari, to intermittent fasting. So I want to know, is it advisable to exercise and still practice intermittent fasting at the same time?
I would say if you are exercising, then you're not supposed to fast. The same way they do for the Muslims. There are people who are exempted from fasting because of the kind of work that they are involved in. And even, for example, pregnant women are not advised to fast during that time because their calorie requirement is quite high. So if you're exercising, you'll find, for example, let me give you an example. The runs like Beyond Zero run. Somebody decides not to take breakfast and goes on decides to do the 10-kilometer run. After some time, they collapse because they don't have enough glucose in the blood stream. Yeah. So I am very much against somebody who's fasting and also exercising. For fasting, you relax. Bare minimum.
Joki, you'd like to ask something?
Yes, sorry, this is from the hygiene section. Nowadays, we're all using hand sanitizers. And so is there any harm of using alcohol-based sanitizers, especially when you use them, we touch our eyes? Yes, we are clean, but it's still, I don't want to call it chemical, but it's still not natural. And we are using it, as we use it, we eat. Is it harmful?
What I would say, like, okay, alcohol itself will evaporate, and what remains on your hands is that the oil thing. Because if you use the alcohol on its own, after some time you'll find that your hands will be peeling and they'll be very dry. So that's why they add the additives so that at least you remain like the moisture in your hands is not depleted. Yeah. That said, I would say, I think, have you tried testing hand sanitizer after sanitizing and testing and like licking your finger? And have you tried?
No.
Have you tried? No, it's not good. It's not pleasant. So I would say if you hand sanitizing, don't eat. If you want to eat, go and wash your hands with soap and water. Actually, soap and water is the most advisable way of sanitizing or cleaning your hands. And WHO says when that option is not available, that's when you're supposed to use a hand sanitizer.
Okay, thank you so much.
Welcome.
All right, I don't think we have more questions for Daktari, but if there are, then you know where to find Daktari. Oh, Robert, you have a question? Robert.
Can I unmute?
Yes, I have a question.
Go ahead.
Daktari, under what criteria did the scientists follow, like, to come up with the 20 minutes, the 20 seconds of hand washing? Why couldn't it be? Why couldn't it be even 30 seconds, or why just 20? Just clear off my curiosity.
Okay, Robert. You know, we do tests actually. So, for example, when we say that we are doing, for example, you've had a urinary tract infection, and we decide to do a culture, or you've had a blood infection and we decide to do a culture. So we basically take your blood and we let the bacteria which was in your blood to grow. Okay. So once it has grown, then we put different antibiotics like drops. We drop. Okay. For example, I try Augmentin, I drop it there. I try Sacilin, I drop it there. Okay. And then we wait and see. After that, we check under the microscope because bacteria moves. Okay. and viruses also move. So I can see that the person is dead and this one is not dead. And now I can tell that this antibiotic works and this one doesn't work. So the same with alcohol. Virus, we drop, and then we wait and see. Yeah, so we can even observe. Nowadays we have those electron microscope, which usually display on the screen. So I don't even need to look on the microscope. And I can actually see movement, then it dies. So from those studies, we found that 20 seconds is more than enough. But you can do 30 seconds if you want. Okay.
Thank you.
Welcome.
All right, thank you so much, Daktari. I think, oh, Frida, you have a question? Kindly unmute.
Okay, Daktari, I'm Sydney.
Sydney.
Yeah, I was asking, for how many years can your liver sustain the intake of alcohol?
Intake of?
Alcohol.
Alcohol.
Yeah.
Now, what I can tell you is we are not the same, okay? As we've talked earlier, we've talked about genetics. For example, there are people who smoke for life and they don't get lung cancer, okay? Somebody else smokes and they get lung cancer. So for you to know if your liver is working, you have to check on a regular basis. So come in, have your liver function checked. There's actually a marker in that liver function test which can tell us if you, for example, if you lie to me that you don't take alcohol, and I do that liver function test, there's something known as GTT. It's going to be high, and I'll say you take alcohol. Okay, so best way to know is just to test. Yeah, and if you find that the markers are increasing, you can decide to stop taking alcohol, reduce your alcohol intake for a while. What I would say, the liver is very good because it regenerates quite fast. It's not like the kidneys. If your kidneys are failing, your kidneys are failing. You have to get new kidneys. So if it was because of certain lifestyle, we have to stop it completely. Same thing with your lungs. So if your lungs are deteriorating, then you have to stop smoking completely. For alcohol, you can decide to stop for a few months and then resume. Yeah, but what I would advise, binge drinking is the main problem for causing alcoholic liver cirrhosis. So ukimaliza chupa mzima unaachana nayo, unakunywa tu ile kiasi yako. Ukisikia that you're already, you're high, because your high is not the same as somebody else's high. So when you reach your high, just start hydrating, taking lots of water. And as you are taking alcohol, and by eating chunk of food, and then after that, now it is drinking till morning. There has to be small bitings in between. Okay. I have lived in Russia, and you know Russians really drink. They're good drinkers, and they can survive the whole night. And what they normally do is that when they are drinking, they take a bit of dried fish, or they take the sunflower seeds like the Arabs do. I've also been in Saudi Arabia, so they do those sunflower seeds in between, and that way it helps to reduce the amount of alcohol which is circulating in your bloodstream at any one time, and that way you do not overwhelm your liver. Same thing with the Panadol tablets, for example. Panadol tablets maximum of 4 grams. That is what the liver can hold. So if more than 4 grams is circulating in the bloodstream, then the liver starts suffering.
Thank you. Thanks.
Karibu.
Jockey, you have a question for Daktari?
The last one. So, is cannabis smoke harmful? Because we've talked about tobacco smoke, and tobacco is harmful. So is cannabis smoke harmful?
Any smoke is harmful. That's the truth of the matter. Doesn't matter whether it is cannabis, whether it is smoke from your charcoal, whatever, the charcoal burner, whether it is whatever you're burning outside, the rubbish and all that. Smoke is smoke, and the soot ends up in your lungs, this alveoli and all that. Okay. Tobacco, main reason why it has people are saying it's bad is because of the nicotine bit. Okay. And the new, I think that new chewable thing which the thing doesn't have it is non-tobacco. Still, they're against it. Basically because of the addictiveness and because of the effect on your mental health and all that. But I would, I mean, taking weed is okay.
Is okay.
But yes, it's okay, but
Okay.
it's the same thing as taking alcohol. So it is your choice. You decide. Okay.
Okay. Thank you so much.
Karib.
So, Daktari, is it a myth that cannabis actually reduces pain when you're in pain?
It is not a myth. Cannabis has been used a lot in pain reduction, even in the ancient times of Egypt, and it is a lot in Afghanistan and those Stan countries. It was basically banned for reasons which have got nothing to do with the cannabis itself. Okay. What I would like to add is that in Kenya, most of the weeds that guys are selling, calling them weed, is not weed, because the high of weed cannot last. You cannot take one joint and it lasts the whole day. Okay. This weed that they are selling, they're adding other additives. And that's why you'll find that most patients who end up in Madare with mental issues or they have gone crazy. And people actually associate this with the intake of weed. It's got nothing to do with that weed, but has got something to do with what they added in that weed to sustain the high for longer than the actual normal weed should last. And if you're buying weed for 10 bob, 20 bob, that is not weed. Okay. Good weed costs 50 bob to 100 bob. So normally what those guys do, they buy the good weed, open it, wrap it in smaller versions and then sell it to the huge masses. Same thing with cocaine. Cocaine is used a lot in New York. Many lawyers, doctors are using cocaine, okay? But what is the difference between that cocaine and the cocaine which is being sold, for example, in Mombasa? In Mombasa, the cocaine has a bit of heroin because pure cocaine is expensive and the normal person cannot afford this pure cocaine. So they add something else to make it cheaper and also to make money. So I would be a bit vigilant on where or your peddler, okay? But as much as possible, I would advise most of these things, you can avoid them. I think you can still have fun without drinking a lot or without smoking, okay? And I mean, at the end of the day, we want to live longer and avoid the hospital issues of being admitted in hospital.
All right, Daktari, thank you so much.
You're welcome.
Do we have more questions? I don't think we do. Yeah, so I'd like to thank you so much, Daktari, for coming and for sparing your time out of your busy schedule to come and give us all that information. I feel very, very educated. That was very insightful. And guys, I like to remind you that you can find Daktari from Monday to Friday at Masai Mall, second floor, Avenue Healthcare Hospital. Yeah, so we'd like to welcome Daktari, do you have any closing remarks before you
Yes, I would like to thank you all for giving me the opportunity to present to you today. You are, I mean, I have enjoyed the show, okay, and I welcome you all to the Avenue Rongai Clinic. And I would also like to close by saying it is Cancer Awareness Month. It is basically for breast cancer, but other cancers are also being screened. And most of our facilities are offering subsidized rates for screening, for example, prostate cancer, for breast ultrasound, and mammogram for people who are over the age of 40. And also colonoscopy, which checks for rectal cancer. So you guys are welcome. Feel free to come in. Even if I'm not there, we have a great team. We have a physician, we have a gynecologist, we have a nutritionist, and very soon we are going to have more of the specialist doctors in that clinic. So you're welcome to come in at any one time.
All right, thank you so much. I'd like to welcome Sylvia Ngari from UAP Insurance. Sylvia, Karibu, kindly introduce yourself, tell us what you do and what you'd like to tell us today.
Thank you so much, Faith. My name is Sylvia Ngari. I'd like to correct Faith from UAP Insurance. I have an agency, but I work with UAP and other companies. So like, I do a cocktail of many insurance companies, but my main business is insurance. So in short, I'm an insurance consultant. So today I am so happy to join you guys. You know, it's been ages since I was there at college, you know, at university level, but I know it's a very exciting journey. And I'll talk about insurance and mostly on health and any other thing that you want to. But I'm this kind of a person, not more of a teacher, but more of interactive. So I would want us to be more social than more of a classroom. So guys, I know so many people here, insurance, you've heard more about insurance, everything insurance, but do we really understand what is insurance? Yeah. Because if you ask someone will, like maybe Robert, can you tell me what is insurance? I'm waiting. Yes, Robert? You can unmute your mic.
Yeah, thank you so much. Yeah, what I think insurance is a step an individual takes in order to have a safe security of property, of anything you think that is valuable to you. So that is what insurance is to me.
Yeah, nice, right? Really on the right track. I can say in short, insurance is where you give your worries to the company in exchange of some reimbursement in case of unfortunalities. Yeah, that if you're worried something that might happen to what you have, your life, your assets, you go to someone and tell them, you know what, I want you to take care of my things or my life or my health in case of anything that it will not take me back. So in short, insurance help you not to go through that risk. In exchange, you pay something to the company for you to get that protection. In short, it's a protection. Yeah. And once you purchase an insurance, you're supposed to get something, a contract that is called a policy document that binds you from to the insurance, to the insurer, saying that you have taken this and this, and in case of anything, this company should pay me, and in case it doesn't, then you can take them to court. Yeah, or maybe take them to IRA. You know, IRA is our bond. It's the insurance regulatory authority that assists the client in case of such claims. If an insurance company doesn't pay you, you can just walk into IRA and they're going to sort your issues out. Nowadays, don't fear insurance companies like Tambo. So let me go straight to health. I can say UAP is among the best company that gives the best health product. And because I've worked with them for so many years, like 10 years, and also we have other companies like Britam and other companies, but also we range them according to how they pay their claims. You know, at the end of the day, as a client, you don't want to just go to a company because of a name, right? You want to go to a company because you want to be of what they are giving you. Are they able to give you what they are promising at the right time? Yeah, we don't want to hear scandals like the ones we had on TV. Some company did not pay some clients. I don't want to mention names. It's not good to mention names. We don't want to go that road. You want to go to an insurance company and you're sure you're secured. Yeah. So in short, I'll just touch on medical cover. I will not share the screen. It's more detailed, but I'll just go. There's some questions that had come to me earlier, and but later you guys can just ask me anything that you want. And you guys, do you have insurance? Insurance, to start from there. You have any medical cover? Anyone can just say so that we can start from there. Yeah?
I have NHIF.
Ah, nice. So, okay, I'll come to there. NHIF, yes, it's an insurance cover, but given by the government. And NHIF, it is a must. It's like sandwich to an insurance cover. So when you're getting an insurance cover, either from UAP, Madison, or wherever, you need an NHIF together. So you cannot say that you'll just get an insurance cover from an insurance company without NHIF. So it is a requirement because there are some things that NHIF pays that the insurance company will not pay. So the NHIF pays and then insurance come and clear. So it's like a partnership in all the health companies. So you'll go to the hospital with your card. Maybe you've gotten a card from UAP, and you're being treated for maybe you've gotten admitted and you need to clear your bills. But then the hospital tells you, "Apana tulipangi hii cover inalipwa na NHIF." And that bit you'll find it all the time. So you need NHIF anytime, any day. That's a requirement. So what do we have in the medical cover? In a medical cover, we have the inpatient cover, we have the outpatient, we have the maternity, we have the funeral cover, and we have the accident cover. So what is the inpatient cover? The inpatient cover is a cover that covers you in case you're admitted. You see, you're working in a hospital and you're not sure what is going to happen. And you're just told, you know what, you're not going home, you're going to stay here for some time. That's where now the inpatient cover comes in. But now when you go walk in to the hospital and you're able to go back home, now whatever pays for that day is called an outpatient cover. Are we clear? Yes. So there's a difference between the outpatient and the inpatient. And when you're purchasing an insurance cover, you can decide either inpatient alone, but you cannot take an outpatient without an inpatient. Reasons why: when you go to the hospital, you're not sure if you're going to be told that you'll be admitted. it's not your call. It's for the doctor's call to say if you're going to go home or not. So for security purposes, it's good to have an inpatient when you're having an outpatient. And if you cannot afford that, you can still have the patient alone. And NHIF can still work as an outpatient, because you find the outpatient is a bit more expensive than the inpatient all the time. Why? Because you go to the hospital more often, yeah, than the times you are admitted. Because if you can recall, the last time you got an admission, maybe it's once or none per year. But the outpatient, you might be having a cough, just run to the hospital and get some medication, or maybe some injuries. That's where now the outpatient comes in. In this cover, the medical cover, we also have the dental. The dental, where you have issues with your tooth, and you want to go do some checkup. You were given something, whatever the dentist is going to do with you inside there. Although that scope of work is covered under dental, not under outpatient. So when you go to the hospital and your cover doesn't have dental and has an outpatient, you will not be covered until you have a dental cover. Yeah. Same case as optical. You see, like I'm wearing spectacles, just as Faye there. Since I had an insurance having that benefit of optical, my outpatient could not have catered for my spectacles. But when you have an optical cover, you can just walk into an optical shop. They're going to do you to run some tests and maybe offer some spectacles according to your taste. So that's where the benefit of optical comes in under the medical cover. So, and also overall of all these, we have the funeral cover. You see, death, you don't call a death. Death can occur at any time, even when you visited the hospital on an outpatient call. So a death cover comes in automatically when you have an inpatient or an outpatient cover. So when you have this cover, there's that benefit of funeral expenses that covers that covers all those expenses that comes in when there's the burial, the flower arrangements, the food, the travel, all those things. And also we have something else called the personal accident cover. Personal accident cover comes in when there is an accident. And an accident doesn't have to be road accident. An accident is where you're injured. You know, it can occur in your bathroom. It can occur when you're playing. Anywhere that there's an accident and something happens, and you run to the hospital. If it's an injury, the hospital will report to the insurance company as an accident. And then I had this question where what are the requirements of having for you to have a medical cover? What are the requirements? How do you know that you're eligible to become to be insured? One, you need to be Kenyan. You need to be born here, and you need to be living in Kenya. You cannot take an insurance cover when you're living in the United Kingdom, and you want to take a medical cover that when you're coming home, you can be using your medical cover, and yet you live abroad. So you need to be eligibly living in Kenya. And then joining age, when one person, the minimum time for joining is at the time of birth, the minimum. So when a baby is born, they automatically, if their parents want to bring them in a medical cover, they can automatically bring in the child after getting the notification certificate. Also, there is the maximum age of joining. maximum age of joining is 70 years. And even if you're 70 and some months, as long as you're not 71 years, you are still able to join in a medical cover. So you can say, you can advise your grandfather who is less than 71 to still join, because we don't have a maximum age of exit. Yeah, maximum age of exit is 0. So you can join in even at 70 years and 2 months and continue as long as we could join the first time. Yeah. So so what else is needed? You need, or there are also documentation that are needed. You need an ID for joining and KRA PIN number, and also a policy. There's an application form to fill in your details before you sign in a cover. Also, we have guys who are senior. We call, there are people we call senior citizens. Senior citizens are people who are 50 years and above. For them to be eligible to join a medical cover, they need to go for a medical test before joining. Yeah, because someone might be, that age, most of them are having some illness. Most of them have high BP. Most of them are diabetic, like the way Daktari said. And that age, most people have kind of some illness. So we don't want someone coming in for a medical cover with such illness without notifying the insurance company. And we are not saying they cannot come into the insurance company. They can still come in, but they need to go for a medical cover, a medical checkup, so that they can be diagnosed and be checked if they are fit and what is existing. Since when they come in, there's something we call waiting period. So when you come in a cover, or you come in to a scheme, a medical scheme, you need to, if you're fit, you just automatically continue enjoying the benefit. But if there's something, you have a chronic illness, like HIV, and AIDS, and those diabetes and something else, there's that waiting period of 10 months. So that's why the senior citizen are supposed to go for medical checkup before then. And then there are also those members who are coming in from another company, and you want to join from maybe UAP to Madison, or maybe Madison to Brigham. For you to actually, if you're coming from, you're like transferring from one company to another, you're able to be given something we call waiver of waiting period. So meaning that if you had a chronic disease meaning that, we say that when you have a chronic disease, you go through a waiting period, right? But if you're doing a transfer, sorry for that. If you're doing a transfer from one insurance company to another one, you need to have a proof of transfer so that you can be waived. You'll just come in and the insurance company will automatically put you on benefits without having any waiting period. Do you have something? Okay, fine. So, and then there was another question that says, how long does the child stop being under their parents' account? Yeah. So most the minimum time, according to the government, is 18 years. But as long as you have proof of schooling, you're still a student until 25 years. So you can still hang there, you can still hang there in your parents' cover back at 25 years. After 25 years, now you can take your individual cover. But as long as you show proof of school. Yeah. I think so. What are the? I think I discussed on the benefits. Did I discuss on the benefits of medical cover? No, not yet. So the benefits of medical cover. Why do you need a medical cover? you need a medical cover because it's going to cater for that personal, it has that personal accident cover. Imagine right now you get an accident and you didn't have a medical cover. You know, an accident, most of the accidents, you'll get their medical bills going up to 1 million plus. So if you had a medical cover, you can imagine the huge, you know, pain and load that is going away from you when you didn't have that 1M to just use on a hospital. So the beneficial aspect is that it's going to assist to clear the bill in a very short time. And the good thing is medical covers pay very fast as long as the daktari give the right report at the right time. So there's that benefit of inpatient, that you can be admitted without worry of money, as long as you have the medical cover will pay. It has that outpatient. Outpatient is where you can just walk in very confidently to the hospital and maybe check up and get your tablets or whatever the doctors have advised and walk out without any hassle. You can get artificial appliances, that is like spectacles, yeah. You can have that is what part. You can have the clutches under the medical cover. It also covers the pre-existing conditions. Yeah, pre-existing conditions are those conditions that you have to live with them. You know, basically, yeah, they are still there. Like I think high BP is part of pre-existing. I don't know if doctor is still there to clarify that. And diabetes as well. It also caters if you want to do dental checkup, optical checkup, and also it has a newborn cover in case you get a baby and you have a medical cover. The baby automatically kicks in before kanzia kutoka kwa hospitali, and then you need to pay up some other premiums once you're out of that hospital. Yeah. So you can get an organ transplant through the medical cover. It also caters for maternity, yeah, and it also caters for last expense. Last expense is the same as funeral cover, and also the chronic diseases, that is the HIV and AIDS. And in case you have some treatment, you want to go abroad for some treatment, still the medical cover caters. In case maybe you want to go to India, and there's also the air evacuation for you to go there, all those expenses are catered for. And also in case you have an emergency, we have the emergency ambulances under the medical cover. So in case you get sick wherever, or maybe you just collapse somewhere and you have an insurance cover, those medical expenses that comes in from the ambulance services, the card is going to cover for that. And the good thing is, once you purchase a medical cover, you get something we call a smart card. You see, like that card ATM, you just swipe. Yeah, you just put your finger and pesa enda kwa hospitali. So there is no hassle. Yeah. I think. Yeah. So what are the exclusions? What are the exclusions? Because people think you can just get a medical cover because it's a medical cover, and you just walk in because it can cater everything. And I had some guy saying that cannabis is nice. Okay, fine. I won't say no, yes, but somehow I had that too. I had that as well. So
correction. I say that cannabis and alcohol are things that even cannabis is going to be legalized sometime soon. So don't be surprised if that happens. But just because it is allowed for you to take, it doesn't mean that you should. Just the same thing as smoking. At the end of the day, it is your choice. That's what I meant. But I'm not advocating for everybody now to start taking cannabis. Personally,
thank you for being there. But I want to ask a question as well as I continue with my presentation. I hear that doctors use a bit of it in some medication. Is it true?
Come again. Come again. I didn't hear the question.
I don't know if it's rumors or true that in hospital cannabis is used part of medication.
Yes, and that's what I meant. The same thing with opium, and we even use, like, for example, morphine. We give morphine to people who have sickle cell disease. Okay, and it's not an issue, but we have cases of doctors being addicted to morphine. So basically, the reason why these things are banned is because of the addictive nature of the medication, and not because of the medication itself causing any adverse effect, but basically overuse.
Oh, okay. That's nice, because that's where I was coming to. Where the insurance will say that they'll not pay because someone overdid it. Yeah. When someone went to the hospital because alikunywa pombe sana, ama, you know, alivuta sana, that's when the medical will not pay. That's an exclusion when it comes to the medical cover. Also, when you're getting pills, infertility, when you're doing your cosmetic surgery, when you want weight management, those are exclusions. Those ones are not catered by the insurance company. You want to do treatment other than the one that registered by the medical practitioner. You want to treat yourself. You know, you just write yourself some medication and you go over the counter. You want to buy yourself. That one will not be catered by the card, by the medical cover that you have. And maybe involved in riots, yeah, knowingly, like whatever we had on the news lately, and someone was among the gang that was hired to do whatever was happening, and such news is on, the insurance company will not pay such incidences because that is self-inflicted. So in case, when you want to do beauty treatment, that one is not also covered, and expenses so recoverable and other insurance like NHIF and WIBA. That is why I said when you have an insurance, you also need NHIF, because there are some things insurance company are supposed to be catered by the NHIF, even if you have the biggest cover. NHF will still strike in, yeah. And in case you are involved in naval, military, or air force operations, you also need to be sure to know that the insurance cover will not cater for that, not unless on an arranged agreement. If they really know that this is military force, they something they are given, there's a different cover for that, but not the individual covers. When you're doing nutritional supplements, those ones are not done over the counter by an insurance company. They're involved in a professional and hazardous sports. That one also is not insured. And also declared pandemic. Yeah, like now we have Corona. The insurance companies are not insuring that. And most people didn't know that, yeah? So those are declared pandemics and any other things that might come. But most of the insurance companies are working in hand to see if they can manage, but they're not going to insure the disease. Yeah. I think other than that, also talk about the products that students take. Are you hearing me? Am I audible? So I'll also talk, I don't know if I talk now, or maybe we take the questions and then we can talk, guys can take in as students. Sid, you can direct me. You unmute. Unmute your mic.
Naambia watu wa unmute mics zao.
Sorry. Frida, I saw like your hand was up. You'd like to ask a question? Okay.
I was asking, do the insurance cover mental health? That was the first question. And the second question, what is the must-haves for it to be considered a good medical insurance?
Pardon your question, I didn't hear.
The first question was whether your insurance covers mental health. And the second was, what are the must-haves for an insurance cover to be considered a good cover, a good plan?
Okay. First, I want to your first question. No, you have to be mentally fit for you to take an insurance cover. I haven't heard of any scenario where someone who is mentally unwell and fit is taking a cover. And so, when you want to know a good plan, insurance packages are tailor-made according to what the client wants. So I can say a good plan is what can cater actually what you want. Let's say you don't want to do a harambe when you have something that has happened to your family, maybe like illness. You can give yourself maybe an approximate of 3 million to 5 million in patients when you're purchasing a cover, and then go down. The premiums are actually straightforward. They are not underwritten, so you'll just, whatever you say, if you say you want 3 million, premium will just be automatic. So I can tell you, when you want to purchase a good cover, purchase something that will cater in case, even if the illness, the bill might come up to how much, and maybe we can say 3 million to the maximum in case of worst scenario. And also, a plan, look for a insurance company that has good reputation in terms of paying premiums. And also look for an insurance company that has the good hospitals that you visit. You know, you also need to take an insurance cover. You can, when you go to the hospitals you go to, and you're able to access the facilities. Because there are other insurance companies you might take right now, and then you're not able to visit certain hospitals. Yeah. I hope I've answered.
Yes.
Jackie, Frida, you have another question?
Yeah, can the premium option be paid in installments?
For the medical cover, we don't have installment arrangement. You pay once, because once you get sick, you know, actually, let me tell you, whatever you pay in an insurance company, comparing to how much you're being covered for, it's very little. I can give you an example of a client that I know who pays 40-something thousand per year, but recently this client used 5 million. So that's why insurance company will always opt for one-off premium because of an eventuality. Because imagine these clients angeambiwa hapana, you pay all the premiums, now we not pay. How could that be? It could not be in a good picture. So you pay one.
All right. Thank you.
Joki, Kuria, you have a question for Sylvia?
Yes, I do. So, most of us, we barely know anything about insurance, and I've heard this thing of core insurance. So, what is core insurance?
Okay.
Core insurance. Core insurance.
That one you had in medicine, right?
No, it's a question. No, it's a question I've been hearing people asking because people barely know anything about insurance. I don't know if it's how you brought up or it's just a culture that you have, but I barely understand what insurance is. I don't know if it's where I pay half of it and the insurance company come in half in. I am not sure, so you can clarify that for us.
Actually, the way I understand for is like a half thing, yeah? And when I talk of medical, I can say there's something which is called copy. And copy is where the company, the client goes to hospital, then you're told you have to pay 500 for you. You're able to use your medical cover. But that's an arrangement is always done by the insurance company. It's not done by all the insurance companies. So some companies will have the core pay, and some insurance and other insurance will not have that aspect of co-paying. So other insurance companies will just take the full responsibility where you just walk in with your card and you're paid for. But other insurance company will tell you you have to pay maybe 1,000 or 5,000, depending on which hospital you're going. Because that scope is actually the hospitals that I think it's the hospitals who which determine the how much you're going to copay.
Thank you so much.
Robert, you have a question?
Yes, I have a question. First, to start with, that was a good talk and a concern. My question goes to, as a concern to what you mentioned about the NHIF. Like when someone is above 25 years, he or she is advised not to be under the parents' cover. So I have a friend called Sydney. He's past 26, and right now, in the event of him not being under the parents' cover, can he take his own cover and include his parents just in case his parents have become so lazy to pay on the continuing cover?
Yes. Once you hit 25 years, you can take individual cover, which is cheaper than parents taking it because the plans are calculated depending on your ages. So the younger you are, the less risky you are. So that's what the insurance company take it. Even when you're taking any kind of insurance, so the younger you are, the less you pay. So it's good also to maybe when you if your friend is 26 years, they can take up an individual cover for themselves, and also include their parents if they want to.
Okay.
Do we have more questions for Sylvia?
Yes, yeah, I have enough.
Sorry?
Yes, I have a question.
Okay.
In this life, we are trying to advocate for like when you start to date someone, you'd want to date them until you marry them. That's what we are advocating for, like to minimize the number of breakups and so on. So this friend called Kulo, I have a friend also called Kulo. He had a girlfriend, and the girlfriend fell sick sometime during the process of them dating. And the girlfriend was trying to advise him that he should have at least an insurance cover that includes her, so that just in case she falls sick or so, the cover can take care of the girlfriend. But the cover didn't allow that. So the girlfriend went, struggled with the deal, and after finishing, they broke up. Means Kulo did not marry the girl. So do you have a cover that someone can take to cover even for the girlfriend, so that you minimize the number of breakups like the one Kulo had?
When you're taking an insurance medical cover, there's no way you'll be asked for a marriage certificate. So, nowadays, I read on the newspaper the other day, some people think they're married, but maybe they are caretakers, there are so many people who think they are married, living with someone in the same house, but they're caretakers, according to the magistrate of that day. So, so many people, you can take a cover and put your partner there, but it's only you who knows the agreement. You can take a cover with the person you love there as your spouse.
Okay. Grace Mabili, you have a question?
Sylvia, my question goes to this time of the pandemic that you're in. I've had so many cases that when people are infected, when they're in hospital, they're not allowed to use the covers. So is it happening also to the UAP, or a certain range of the covers? And why? Because you see, this pandemic was planned for anyone.
I think I read from the general experience that in case of a declared pandemic, it is not, or a natural disaster declared, wherever Corona was declared worldwide as a pandemic, meaning the insurance company, no insurance company is covering right now, either Akuna, yeah. So that the government offering some services until some day when our people, or maybe when all of us, the guys who were being told they have to tack on some money, but it was supposed to be a government initiative to support the sick. So no insurance company is covering that.
Can I add something, Sylvia?
Yes.
Yeah, well, I can tell Grace that insurance companies, all of them, were covering, but for treatment in a government facility. And as to date, the only insurance company which is covering for private is APA insurance. But all the rest were covering if you are admitted in government facility and not a private facility.
But only for treatment, not some treatment, not for
yeah,
the
just
pandemic.
For treatment, just for treatment. Yeah.
Okay.
Do we have more questions for either Daktari or Sylvia now?
I can ask Sylvia a question. I have a question for Sylvia. Sylvia, I also have a friend. I'm worried about,
yeah.
For example, the expatriates who are working here. And I also have students nowadays, for example, in UN, who have come from other countries. Is there a cover for them? Because I heard you mention that you have to be a Kenyan.
That one is not, it doesn't fall on the individual covers, but that one is tailor-made. It's tailor-made.
It's tailor-made, so I can still be covered by UAP, but a different kind of cover.
Tailor-made.
Okay.
Yeah, under a group.
As a group.
Under a group, not, yeah, as a group.
Okay.
Do we have more questions? Frida, you have a question?
No, I'm good. Thank you.
All right. So I'd like to welcome Frida now to give us a vote of thanks and also a closing prayer. I think this has been the most informative Zoom meeting I've ever been in. So at least I'm taking home a lot and I'm learning a lot. And I'll be sure to consult Sylvia and also Daktari after this, especially for the insurance cover and also for more medical checkups. Yeah.
Faith, can I add something?
Mm-hmm.
I want to add something.
Okay.
I was to touch on if a student maybe is not able to get medical cover,
okay,
it is always advisable to have a personal accident cover. And you see, personal accident cover covers a bit of some medical in case of injuries and in case of those accidents. And it doesn't have to be a car accident, but it really helps a lot because, and then it's very cheap. It's not very affordable. Use the word affordable, because you can imagine a minimum one you can for a personal accident you can pay per year. It's around 1,272 shillings. Yeah, when you have a personal accident cover. Yeah, so don't limit yourself from getting covers. They're really helpful. Yeah, they're really helpful. And also as you students, I know most of you guys are not working, but at least you have those savings kidogo kidogo yenye unaweza kuwa unajiwekea. Once you go for internship and attachment, you have something working for you. So you can be saving as little as 1,000 per month and have something that you are able to access once you're able to stand on your own without relying on maybe your guardian.
All right. I'd like to hear from everyone what you think about the event and everything. So closing remarks from basically everyone. The Clique event planners, to be specific. Starting from Faith. Faith Minor, could you please tell us something?
Not a closing remarks, but so you mentioned about the senior citizen for medical test before joining a medical an insurance. So what if I go for the medical test and find out that I'm diabetic or something like that? So what's next? Do I get an insurance cover?
Yes, you can tell why you go for a medical checkup. It's able to alert the insurance company that this client A has a condition. The insurance company is ready to pay up, because if you didn't go for that checkup or if you didn't disclose that information, by the time you want to be paid, you're going for some you want your cover to pay up. The insurance company will not pay up because you refuse to disclose the information. So yes, you will get insurance company cover, and that is where there's something we call a waiting period. A waiting period kicks in. Yeah, so you'll for a certain month, 10 months. Until then, you're able to the insurance is then supposed to pay up for that condition. But you can still be using your card for other visits, but not for that specific condition until 10 months over. So by the time you're renewing, you'll not go for another waiting period. You'll just automatically kick in, because they do this. Because there are some clients who come in to take the cards because of specific conditions. You're not taking them because you want to, get that reimbursement in case of loss, but you want to take that cover so that you can be paid because you're having a condition. That is why the insurance company always a waiting period.
Okay, thank you so much.
Grace Mabili, your hand was up. You'd like to say something?
Mine is not a question, but just thank Terry and Sylvia. We're so grateful. As in, we're so grateful. So as we might plan another thing that you guys can come back, because I've seen people in the comment section asking for the same. So thank you so much. Thank you.
Thanks, Grace. Njoki Kuria, you'd like to say something?
Yes. So I'd like to thank everyone. That we have people from abroad also who are here. So we'd like to thank you for your time and for your participation, and Dr. Carl and also to Sylvia. Thank you so much for your time and the knowledge that you impacted on us. We hope to retain it in our memories for as long as we can remember. And also thank you to Clique. They have really outdone themselves in this way. Thank you so much.
All right. Frida and Sydney, would you like to say something?
I'd like to say that the event was a success, and thank you to everyone that attended, and it was educative. Yeah.
Yes, we are honored.
All right. Thank you so much. Robert?
Yeah, I'd just love to thank the speakers so much, because at least I've learned something that has been disturbing me about the 20 seconds of hand washing. I never knew what material was used to reach to that. And also, at least I've learned something from Sylvia about the UAP. My family and I have always been wanting to know something about this, and I know they are here with us and they have listened in. And I think I was waiting for this event to enable me to at least have an insurance cover, health insurance cover. So thank you so much, guys.
Thank you, Robert. Before we end this, Sylvia, there was a question for you by Esther. Esther asked, what does insurance companies mean when they say they have sub-limits on some medical conditions?
Sublimit means there are certain amounts that they cannot go above. So there are certain, especially that one applies when you have chronic illness and the pre-existing condition. So they just, when you have the chronic illness, it has up to a certain amount that it can pay. And that one is not, if you have a cover, like for example, if you have a cover of 2 million, it doesn't, your cover will not pay up to 2 million when you have that chronic disease. But on your contract, it is noted down that if in case of chronic disease, it goes up to a certain amount. So meaning for such a condition, it will cater up to a certain amount. That is what they mean when they say a sublimit.
All right, that's understood. Sylvia, would you like to have something to tell us as your closing remarks?
Yes, I would agree. I'm really happy you guys having me on board. And it was nice. It was a nice forum. I learned a lot from Daktari and from you guys. It was really warm. And also, I would want to encourage you guys. Yes, person one and cover. They are the best. They are good. They'll help you someday. And also learn to save kidogo kidogo, so that when you reach 30 plus, you will be able to financially stable before you get that job or that business. Kidogo kidogo too, it will go a long way. Yeah.
Okay, thank you so much. I'm so grateful. I can't even say much. Yeah, so Faith, would you like to please end this with a word of prayer, kindly?
Thank you so much, Dr. and Sylvia, for this platform. It was really informative. Yeah, and so let's pray. Father Almighty God, we come before you this evening. And thank you for the care and protection, my Lord. Heavenly Master, Lord God, thank you for making this event a success. Heavenly Master, Lord God, may you bless Sylvia, may you bless Dr. my Lord. King of glory, even as we are going to continue with our evening, may you bless us, and it's all in Jesus' name we pray, trusting and believing.
Amen.
Amen.
Thank you so much.